don't think we were really on time, but we're going to go with it.
Welcome
to week 28. It's week 28. I checked beforehand of the Crazy Raider Chicks live events. Thanks for joining us again this week. We've got another amazing guest. I am Nikki Rome. I've got Winter Navi with us again and Rebecca White, our standard. But this week we also recruited Annalee of Boundless and Curious to talk to us a little bit about holistic health through her viewpoint as a nurse. So welcome, Anna. Thanks for coming.
My pleasure. Thank you for having me.
You are so very welcome. Why don't you start by kicking us off? Tell us a little bit about yourself and let's define holistic and then we'll kind of jump into it. How's that sound?
Yeah, sounds good. So holistic, when I talk about holistic wellness or holistic health, holistic kind of means all encompassing. Like our health is a lot more than just, our blood pressure or, things like that, the medications we take. Our health is far more complex. It involves things like our creativity, our finances, our career, the food we eat, the water we drink, the air we breathe, our relationships, our physical health, of course, but then also our mental and emotional health, our spiritual health, our social life type relationships, things like that. So, like we were kind of mentioning before, a lot of Eastern modalities are pretty holistic. They view the whole person, not just little chunks of the person. Western medicine is finally starting to catch up to that a little bit. Better late than never. But they're starting to now realize that, if you are in spiritual distress, you are not going to physically heal as well after a surgery or something like that. And so they're starting to realize that it's super important to look at the whole person and all aspects, not just, the physical signs and symptoms of what's going on. So as a nurse, but also as a holistic health and wellness coach, that is what I try to do with the people I work with is, look at them as a whole person, not just as, this handful of symptoms that need to be dealt with.
Very cool.
That's very cool.
So, who wants to kick us off? Becca? Surprise, she's got a question.
Yeah, I saw her wheels turning.
I have several.
I know.
What did you say, Winter?
I saw your wheels turning, so I just...
We can see it when you're about to talk. Your whole body leans forward a little and you go like this. And then it comes out.
So for nursing, what do you do professionally as a nurse? Like, what kind of nursing, if you don't mind?
Yeah,
sharing.
No. So I work at our local hospital. I am a float nurse, which means that I float to all of our med-surg floors. So basically I show up to work in the morning and they're like, oh, you're going to this unit today because they didn't have enough core staff. So you're going there. And so, yeah, I float kind of all over the place. And then I, have a basic patient assignment. I take care of those patients for my 12-hour shift and then pass them off to the next nurse. So, but yeah.
Sorry, Britt is watching and she says nursing surprise.
Kind of, yes.
Is that what you call it?
It's kind of. Yeah, we basically all of the float staff are just like, don't let me go to the COVID unit today. Don't let me go to the COVID unit today. I was there for like the past 3 days and, my head hurts from the PAPR I had to wear. And then we get there and see where we're assigned and we're just like, oh, thank God I'm not in the COVID unit today. But
so do you think it makes it harder because you're a float nurse to kind of really get to know your patient and treat them in the way that you want to? Or were you ever, so my husband's a nurse and sometimes like he'll turn over in the morning to someone else, but then he'll get them back the next night. So sometimes, and he was neuro for a while, so he could have the same patient for quite a while and really get to know them and their family. And so I think it kind of, I know it from him, it adjusted his approach a little bit because he had the chance to know them, but floating, I imagine the chance of you seeing the same patient more than once even has got to be pretty rare, huh?
It's pretty slim. you know, a lot of times when patients are there for, you know, more than just a couple days, I do have a higher chance, I guess, of seeing them again. But a lot of it has to do with, I guess, just how the patients and I interact. I feel like I get to know my patients, most of them at least, you know, decently well. Most shifts, I'll actually talk to their family members who are calling in to, you know, check in, see how they're doing, looking for an update. So, you know, and throughout a 12-hour shift, I work 7 a.m. to 7 p.m. Ideally, usually I'm there till closer to 8, but, you know, I'll sometimes talk to their family member, you know, 2 or 3 times with updates, depending on what's going on with them. So I feel like I, you know, I'm able to connect decently enough to, you know, meet them where they're at and then kind of figure out, you know, what it is, what they need, aside from just, you know, the obvious healthcare stuff. You know, what are their other kind of underlying needs that I can help with? So, and I know that a lot of people who, you know, have just one unit that they work on, they really like that because, you know, they get to know their patients, they get to know the staff there. But I think that because I get bored really easily, I like floating so that way I'm not on the same unit every day. And I feel like it helps me not get kind of like stuck in like the same rut, because that's really easy for me to do. And it's really comfortable for me to do the same thing every day. So floating between the units, it's almost just like though that I just have one big hospital unit that I float to. So, but yeah, I don't know if that answered that question or not.
It did.
Okay. Good.
I'm sorry, where are you located?
I'm in Bellingham, Washington. So just about 2 hours north of Seattle.
Cool.
The very opposite end of the continental U.S. from us. Yeah.
Well, not me. I'm closer.
Not you. Right. Not you.
Oh, okay.
Yeah, that's crazy.
So how do you differentiate what you do in the hospital to what you do in your business?
So when I am working in the hospital as a nurse, I use my coaching all day, every day. Coaching is a huge part of nursing for me, and for a lot of nurses, actually, I think. But when I am coaching outside of the hospital, it is usually not just around very specific health related things. It's a much broader scope. When I'm coaching outside of the hospital, it could be on any aspect of wellness that we mentioned earlier. Also, you know, if someone has like a particular project they're working on, but they're kind of stuck on, you know, sometimes I will be able to help coach them through whatever sticky bit they're stuck in. So that way they can, you know, through asking questions of them, they're able to kind of work their own way through and figure out where they want to go with that project. And that's really what coaching is it's kind of, you know, we're not telling people answers and giving people, you know, you need to do this, you need to do that. Coaching, whether it's, you know, health coaching or just general life wellness coaching, we're basically helping through asking questions. We're helping people discover, you know, what is for them their highest, you know, ideal of wellness, what wellness looks like to them. Because it's going to look different for everyone. You know, if someone is a smoker, yeah, that's bad for their physical health. But if, you know, that is something that for whatever reason is just deeply important to them and they're not willing to give that up, then, you know, that is their choice and we need to respect that. But then we can still help them have the highest level of wellness possible for them, you know, with other health things, all things considered. So, but basically in coaching, we believe that, you know, and in nursing too, I believe this, you know, everyone has their innate inner wisdom. You know, we all know ourselves better than anyone else could ever know us. And, you know, we all have the capacity to, you know, understand what it is we need and want, even if we need someone else to kind of like help ask questions to us, help us figure out what that is. You know, we have all the answers. They're just sometimes tucked in the back corner of our brain under a pile of cobwebs. So that's kind of what coaching does. We help shine the flashlight around the attic of your brain. So that way, you know, you can be like, oh, hey, there's the answer over there. It's under, you know, that old creepy Jack in the Box or whatever is in your personal attic. So yeah,
like the freezer pop that fell behind.
Exactly. We help you find that. We help you find that freezer pop. We're like, have you looked beneath the peas?
That's awesome.
Yeah. You guys missed a very interesting conversation over freezer pops earlier, clearly. The moral of the story is there's always one in your fridge, whether you know it or not.
Freezer pop there.
I love, though, I've got to say, I love how your thought of everyone else's mind is a creepy Jack in the Box. Like that was your go-to. That's
everyone's got something, you know, weird and kind of bizarre
like
in
Jack
their
in the Boxy.
Personal attic, you know, whether it's a Jack in the Box or I don't know.
I like to picture mine as like the creepy lady on the way out of the haunted mansion. You know, the one is like with the glowy face. Like she's my Jack in the Box. Okay. Anyway, sorry.
No, I wanted to know, when did you develop an interest in the holistic aspect of it? Like, were you a nurse for a while and then you started thinking, oh, wow, we need to do this a little, you know, started thinking about that? Or was that something that you were interested for a long time and then you got into nursing or?
I think closer to the second thing. I've always been interested in alternative stuff, like alternative medicines. I'm a big, you know, herb geek. I love herbal medicine, you know, but also just kind of what I'm looking for. Basically, healing modalities that work with Western medicine. Like I think Western medicine is great. I think that it has its place for sure. You know, our medications can do amazing things. You know, my dad's a type 1 diabetic. If we didn't have insulin, he wouldn't have lived as long as he has, and I probably wouldn't be here. But at the same time, you know, I also feel like pills are not always the answer, especially when, you know, the things that are causing the health problems may not necessarily fully have a physical root cause. Like it could be, you know, emotional, it could be, you know, some other aspect of our life is out of balance. But I think that, you know, things like herbs, I'm probably one of the, you know, most woo-woo nurses you'll find out there. But, you know, I really think that people can, complementary medicine is what I was looking for earlier, but things like essential oils, things like herbal medicine, things like, you know, use your crystals if you got them, if it works for you. Basically, you know, there's all different kinds of things out there that don't necessarily fit neatly into Western medicine's boxes. But if it works for you, take what works and leave the rest. No, I don't think anyone should stop taking their blood pressure meds in favor of essential oils. Please don't do that. But
if you could work your way out of that.
Right. And
right?
You know,
like
a lot of people for just take blood pressure, for example, or cholesterol, like high cholesterol. You know, a lot of those things are, you know, they're modifiable. They have, you know, lifestyle factors that people can change to then, you know, lower their blood pressure, you know, lower their stress, you know, change a little bit how they eat, you know, change their, you know, exercise type stuff. Yeah, so like there's a lot of things that are health issues, chronic health issues in the US at least, or, you know, generally Western cultures, we can change with diet, lifestyle, or at least affect it and lower our health risks. Nikki says, what is, the Institute for Integrative Nutrition is where I did my health coach program that I graduated from and am certified through. And their circle of life is basically, Britt posted that link. Thank you, Britt. But the circle of life is basically the holistic, view of what health and wellness is. It includes the things like creativity, finances, career, education, health, relationships, spirituality, things like that. So on their website, you can click the link Britt put in there, and it will take you to an interactive circle of life that you can kind of, rate your health in these areas. And then you can get kind of like a pie graph kind of view of where your health is in various areas. And then, that way you can look at that and be like, oh, my finances health is kind of at the bottom. So, what do I want to do to help bring that more into balance? And then that way you can, sit with that, journal that, figure out the little steps you can take to change that. So that way, you can bring that aspect of your health more into balance with the rest of things. Because really, when we have things in balance, that's when, our bodies and minds and spirits are, happiest. Equilibrium, homeostasis.
So can I bring up, I don't want to mention any specific people, but it's hard. So people in my life that have had a lot of health concerns, but not necessarily specific health concerns, not feeling well, being sick all the time, that kind of thing.
Yeah.
Who did not want to try to get medicine, Western medicine, but wanted to avoid any kind of medications and pills. And so went the herbal, trying all the natural, so on, quote unquote, possibly. We don't really know if it's natural, but it's called natural, right? I mean,
right.
So
it's a very loose term there.
to find, basically, if it's not FDA approved, then it's probably good. But to me, it doesn't make sense, but that's just me. So anyway, but to find out that so much of it, in my opinion, was psychosomatic because of high stress, not dealing with traumas and not dealing with all the things. Herbs might help you rest a little, but like if you're, again, my opinion, if you're not dealing with the problem, all this, no matter what it, even if medication, like if you're not dealing with the problem, if it's coming because of your lifestyle or, whatever.
Yep.
I don't know. How do you,
So
we send people to you, I guess, if we think that's the issue.
Definitely. And that's partly where primary care is so important. And having a good primary care provider, family doctor, whatever you want to call them, and that whether it's a doctor, a physician assistant, a nurse practitioner, a naturopath, whomever, but having someone kind of as like the hub of your care, that's so important, because then that way they can work with you to be like, oh, you're having all of these symptoms. Let's try and figure out the root cause. Because we can throw pills at people all day long, but if we're not addressing the root cause, it's just like putting a Band-Aid on a broken leg. It's not going to do anything. And especially with things that come from, places of mental health, like depression and anxiety, for example. Those are both things that I have chronically, struggled with my whole life, and that I am currently medicated for. But that's not the end of it. I know that my pills are not going to fix all those things. If I don't do my self-care, therapy is everyone should go to therapy. We all have something in our life that has traumatized us at some point in time that we would benefit working through. But, and just having a neutral party to talk with, like everyone go to therapy. But, I think for a lot of things, for whatever kind of health issue we're having, no matter where that falls on that circle of life, if we're just trying to make the symptoms go away, but we're not addressing the root cause, we'll never get better. And so I think that, if people are having symptoms, work with your provider, get referrals for, mental health care, other kinds of health care, whatever it is. But, always ask yourself, well, why? And stress, stress may be kind of an emotional, mental health type thing, but it does present physically in our bodies. You know, it manifests with really impressive physical symptoms sometimes. Mm-hmm. And so learning how to manage stress and deal with stress and have healthy coping, that can just be huge in helping people with a huge variety of symptoms, you know, mental and physical health wise.
Tanya is expressing frustration that her primary care doesn't take enough time to actually talk about anything. She says 15-minute appointment and then out the door. And yeah,
that is one of the most frustrating parts of primary care. And I know from working in primary care previously to where I work now, that's also a frustration of the primary care providers. Unfortunately, our American healthcare system is a business, and it's for even not-for-profits have to make profit, or they close. But it's always so frustrating. And I've had this problem with previous primary care providers too, where I feel like I'm just on a conveyor belt and they're like, okay, you're not dead, bye. I'm like, oh, okay, that's it. Okay, bye. And 15, 20-minute appointments really aren't long enough to address things. And it's frustrating for sure for, you know, the patients, for the providers, for everybody. Some of the things that I've done in the past that have helped me mitigate that, you know, frustration at least a little bit is I have like a list with me when I go in where I'm just like, these are the top 1 or 2 things I need to talk to my PCP about this visit. And then that way I make sure that I don't forget or get sidetracked or like my, you know, squirrels run off in some other direction. And I'm like, come back.
Yeah. Well, they're asking you something or trying to talk about something that may not even be important to you.
And exactly. And so I'm like, no, I'm here for this reason right here, you know, and also, you know, those visits, like really, if you can have one problem that you're going for that visit for, you know, maybe 2 at most, then you're more likely to get those needs answered. Instead of like a list of 5. But also it's okay to, if you're not, you know, if you either don't like your primary care provider, you don't feel safe or comfortable with them, or you just feel like they're not willing to, you know, take that 15 minutes they have with you, you know, or they're just not able or willing to listen. It's okay to change PCPs. I know it's a royal pain. I personally hate having to shop for a doctor. It's like, I'd rather go bra shopping, which
wow,
but
that's really bad.
Right? Like I hate trying to find a new doctor. I'm just like, ugh. But I finally took my own advice and found a new primary care provider after like 2 years of just not really jiving with my one that I had before. She was a great nurse practitioner, but she just wasn't quite in alignment with, you know, what my needs were. So I found a new one, and she's awesome and great. And I'm really grateful that I embraced that discomfort and like went looking. But unfortunately, our healthcare system is an incredibly frustrating system to deal with at the best of times. And unfortunately, our healthcare system is really more of a sick care system. You know, preventative health does not get the time it needs to really be super, you know, as effective as it could be. Like it's always good to do your primary care, your preventative care. But that I think is why we're seeing so many people, this frustration with our, you know, crappy healthcare system and our, you know, falling apart healthcare model. That's why we're seeing people who are, you know, going into things like nurse coaching and, you know, alternative medicine. I know that naturopaths usually have more time to spend with their clients. So if people's insurance covers that, or you can afford to pay out of pocket, maybe look into that. But yeah, our healthcare is frustrating.
Can I catch us up on a couple of comments, or unless Winter wants to? So I'll start at the top, first of all. So Britt says coaching does not replace healthcare or therapy, but it complements it. Holistic coaching is piece of the puzzle for some.
Yep.
And then Tanya said recommended The Body Keeps the Score, the book, and Britt seconded it, and I thirded it, and
I
probably
fourth that.
I don't know how you keep saying that, but yeah, I heard so much about that before I finally started reading it. But it's crazy how much of what we feel and our kids and kids' kids even feel that gets passed down.
Yep.
Sorry, there was more than that. Tanya says with rare chronic illness, she carries a whole binder when she goes in to the doctor.
Yep.
And that she chose a health plan that doesn't need referrals because of the dismissive nature of her PCP and others on her healthcare team, so that she doesn't have to get referrals anymore. I didn't even know that was possible. That's interesting.
Yeah, for some it is.
And Britt said she seconds that.
Yep. And it can be incredibly frustrating when you have a chronic illness, especially something like, for example, fibromyalgia, where half the providers in the US are just like, well, that's not a real diagnosis. Well, actually, yes, it is. There are very specific criteria that you have to meet. Or if it's something that is kind of nebulous, where it might be a couple things, but no one's really sure yet. It's so frustrating to go in and basically, feel absolutely insane because people are like, well, you might be feeling this, but there's nothing wrong with you because we can't see anything on the tests. And you're like, not how that works, but okay. But yeah, it can be incredibly frustrating. So any information like that binder, that is a beautiful, beautiful, fantastic thing. And keeping lists of, either your symptoms or your meds or, your providers, if you have multiple providers and multiple specialties like that, that's great. It's awesome. And
I feel like that's where the holistic nature of what you're doing can play such a big part too, because if they're saying, oh, well, your stomach hurts, but there's nothing there, or we don't see anything there. Well, what are the other things that might be causing that isn't actually your stomach, right?
Right. And because our bodies can have referred pain, something is wrong somewhere, but it hurts somewhere else. Or, if we're carrying, memories, whether we know them or not, buried trauma, we can have physical symptoms from, traumas that we've buried from, before we were verbal, and we may not remember them, but, that trauma still lives in our body. So yeah, it can be really complex and really difficult. And, there are more things out there than we currently know. There's lots of things that we're still just discovering science-wise. And unfortunately, in healthcare, science discovers something and then it takes like 10, 20 years for it to become evidence-based practice. And then you got to try and, reteach all of the, healthcare providers, whether they're CNAs, nurses, doctors, whatever, well, we thought it was this way for the past, 200 years, but it's actually this over here. And trying to change people's minds can be very difficult, even though you're like, I have proof. So yeah.
Winter, do you want to read the next comments? Do you have them up? They're really hard
to
pronounce.
There's a few of them.
So I thought it would be fun if you did it instead of me.
Okay, so you ended on, I second that tip. So Tanya says, I have fibro and chronic fatigue on top of her genetic condition. Her PCP told her that she had pretty hands when she asked, it scrolled on me. Told her she had pretty hands when she asked for RHEUM, RHEUM referral despite normal
rheumatology.
labs.
Yeah. So yeah, like rheumatology would be for autoimmune stuff. And sometimes there are autoimmune issues where you have normal labs. And, you know, it can be really frustrating when you are doing your own research because your provider, for whatever reason, just hasn't or won't or can't, or I don't know, you know, and you're asking for this thing. And instead of just doing the simple thing of giving you the referral, they're just like, nah, your hands look fine. There's lots of other things that can be an issue without, you know, physical symptoms being like visibly obvious yet. Like, so yeah, that can be totally frustrating.
Yeah, and Britt agreed like you did, and she said that it's so true for things like fibromyalgia and then a lot of other things that I can't pronounce.
That's why I let you do it.
Let me see if I can.
Let me look.
She said she could go on for years, so.
Let's see.
Oh,
yeah. Erythromyalgia, autonomic dysfunction, CFS, Ehlers-Danlos syndrome. A lot of these things have either genetic or autoimmune components, and they can be really difficult to differentiate between them and lupus, for example, in their very, very early stages, because a lot of autoimmune diseases, you know, when they're first starting out and first kind of appearing, you know, you can have low positive labs or no positive labs. And then, you know, it basically, you're like, okay, well, you have this positive lab, but what does it mean? It doesn't really tell you what it is. And so it can be really frustrating, and it can take years to get an accurate diagnosis. And it can be really hard because sometimes providers are not as compassionate or polite or professional as they should be. And sometimes
so that was me. When I was diagnosed with an autoimmune disease, I met with a rheumatologist who said, I know you have something, but I don't know what you have.
Mm-hmm.
We're going to start treating it now. And it only came from a very nosy, extremely thorough primary care who, if I get 15 minutes, that's a lot. Like, she's like a 5 to 7 minute doctor. In fact, she talks and goes so fast that she leaves, and then her PA tells you everything all over again. However, she's the most thorough doctor I've ever had.
Mm-hmm.
So as much as she drives me crazy and I feel like I can't ask her questions or talk to her, I have answers to things in my life I've never had before.
Yeah.
The rheumatologist was the one that shook me, though, because she was like, well, it's positive now. It could not be positive in 3 months. It could be positive again in 6 months. Like, when you're in the beginning, you don't always even test positive for anything. Then once they figure out what I had to do special work that had to go to a special lab in California to potentially rule out things, but never a true diagnosis. And so that alone, right? You're in a flare up for a disease you've never had before, and they're not even certain which one it is, but stress exasperates it, and food and lack of sleep and all the other things do. And you're like, how do you think I'm going to get better if you can't tell me what's wrong with me? And so, and we're not even talking about how hard it is to find a prescription that works.
Right. Or if there one exists.
Or if there's one that works. Yeah, that's even out there. I don't know, but going through this myself over the last 2 years, I swear to you, I feel like almost everybody I know has some type of autoimmune disease. And so for that much of it to be unanswered and no one to know is scary. Yep. It is scary.
It's scary, and it's incredibly frustrating, and it can be really disheartening, you know, sometimes.
Mm-hmm. I know this is not a COVID related really topic, but I'm thinking about it based on what Nikki said, because I had a friend who did a COVID test, and it was negative. That night she came with a fever. The next day she took another test and it was positive. So talking about like all these autoimmune things and all these different things, how often is that a possibility where you get tested, it's not there, and it comes in? How do you bring that back up to a primary care saying, hey, can we try this again? Or will they even try?
Yeah, sometimes they will. It depends on who your primary care provider is. With the COVID thing, what probably happened with her is that when you get COVID or any other virus like the flu or something like that they're testing for, your viral load has to hit a certain level before it's detectable. So that's like when we had people, when I worked in the clinic, when they were, you know, like, oh, I was exposed to COVID. but I'm not having any symptoms. We're like, well, you need to wait, roughly 5 to 7 days before you get tested. That way, if you do have the infection, your viral load will be high enough to detect. Otherwise, we might give you a false negative test. So that's probably what happened with your friend. But, or it could just have been the test gave a false negative. Unfortunately, they're not perfect. But with the autoimmune tests,
wait, I'm sorry. Britt interrupted. She said, "Explain what viral load is."
Oh, I'm sorry.
You go on. There's other comments too, but you gotta start there.
Okay, so viral load is basically how much of the virus is in your system. Like if you have, one little virus particle hanging out in your body and it's like, I'm going to invade this cell and make it explode and then, have my little virus babies go off, you have to have a certain number of exploding like alien chest burster virus babies exploding your cells and like multiplying before a lab test can detect them. So if you just have like one little bit of virus, it's not detectable. You might have to have like 10,000 like that. Those are not precise, like literal numbers, but you get my gist. So yes, that's what viral load is, when you have enough, like how much virus is in your system versus not.
And is that comparable to the autoimmune kind of things too, where like you need a certain amount of dysregulation or whatever you want to call it in your body?
I think that's what I meant.
Gotcha.
So my testing started with inflammation testing. And so if you're not in a flare-up, then you may not have high inflammation. So the first test that does the first markers likely wouldn't have picked it up.
Right.
My primary care ordered that first test.
Mm-hmm.
And when my inflammation was through the roof, she was like, you need a rheumatologist.
Yeah.
Which I will say, to answer your question about the multiple testing, I've never had a doctor who did that until this one. Because I was also recently diagnosed with this blood clotting disorder, which probably answers a lot of infertility issues I had quite a few years ago. It was never detected. But I tested positive once and then negative, and they tested me again 3 months later and I was positive again. And you have to have a certain amount of positives in a period of time. And they were like, nope, you really do have it. Yeah. But I never have had a doctor that, again, is that thorough, and does that. Because usually it's like, oh, no, you're fine. One and done.
Yeah. And so with a lot of things like that, one test is not sufficient because like with the inflammation test, there's 2 different labs that they generally check first to see if there's just inflammation present somewhere in your body. And, sometimes one of them is elevated, sometimes the other one, sometimes both. But, as your inflammation fluctuates, so will those lab values. So like Nikki said, if you're not in the middle of a, pain flare or some other kind of flare, where that, inflammation is high enough to be detected, they'll be like, oh no, they're fine. It's fine, whatever. And then the same thing with the anti-nuclear antibody test, which is an ANA, which basically looks to see if you have, autoimmune activity going on in your body. Is your body attacking itself? You can have low positives, you can have, a high positive, but it can totally fluctuate and go back and forth. And that can be incredibly frustrating because you can be like, well, I know something is happening because I had this one lab test and it was a low positive, but now I have nothing happening. What the heck? But I still feel like crap. And then, I have another low positive, but it's not enough information for them to be like, oh, it's lupus. Oh, it's this. Oh, it's that. It's just, you have a low positive. So you have some sort of autoimmune thing happening, but sucks to be you because we don't know. And you're just like, thanks.
Are there some key words that you can say to your practitioner to help them recognize what's going on to you, or to start doing those type of testing? Just take note instead of them saying, oh, you look fine.
I think that if, you are thinking that you might be having some autoimmune issues, asking for, some really basic, like ask for some basic specific labs to check to see about, autoimmunity issues going on, inflammation, things like that. Because our bodies, inflammation is one of the first signs that something is out of whack. and that, something is just not quite right. Even if we don't know what, if we know that there's inflammation, we know something weird is happening that isn't normal. And so I think that, if you have a good primary care provider and you go to them and you're like, here is my list of symptoms, here is what I've tried that has not worked. If you have things you've tried that have worked, include those too, because that might also be helpful. Also, if you are able to find any family history you may have of people who, even if it's anecdotal, if they were never officially diagnosed, because especially, our, grandparents, great grandparents, if they were not, if they lived in any kind of poverty, they would not have gone to the doctor unless they were like dying or their leg fell off. Like you just didn't go because you didn't have money to go. But, there's often you can be like, oh yeah, great grandma so-and-so had, really gnarled, painful hands. And so, her, granddaughters did this to help relieve the pain. You can be like, oh, well, maybe she had, rheumatoid arthritis in her hands because that's what it sounds like. So even if you don't have like, oh yeah, great grandma so-and-so had a genetic test, which didn't exist when she was alive, you can just be like, my great grandma very likely had this. And then that way they at least can be like, oh, well, maybe we should look in that direction.
Britt is saying,
That's
like
helpful.
at the doctor, saying like, I'm concerned about A, B, C, whatever things it is. What are the options for testing? Or I have a family history of this. Can we test for that? Or now she's saying I've experienced A, B, C, and have tried
And I've
D,
tried.
E, F, G
Yeah.
without relief. I need this investigated. What are my options?
Yep. And then
you move on to the
also
strangling of the doctor.
Also, yes, on occasion, but also just, it can be really hard to advocate for yourself, at first, because until recently, we've had a very paternalistic model of care where the doctor knows best. And, that is not true. The doctors know a lot of stuff. Our primary care providers are very intelligent. They know a ton of things, but we know our own bodies best. And we, when we're able to listen to our bodies when they're speaking up, saying, hey, something's not right. I don't feel good. Something's up. Something's off. And we are willing to listen to that, little voice that we all have, our intuition, our gut, whatever you want to call it, and then seek help for that. The more we do it and the more we practice it, no matter how uncomfortable or, terrifying it can be, the better advocates we'll become for ourselves. But it takes practice. It's not easy for most people to speak up to their provider and be like, actually, no, I think you're wrong. Something's wrong. Something's going on. I need to know what. I would like to look into why these things are happening with me. But continue to advocate for yourself. And if your primary care provider is not willing to help you, figure out what's going on, then I would highly encourage you to look for a new one. Just because we need to be able to trust them to also trust us to an extent.
Okay. Sonia just asked, what are your biggest, and I think you kind of went over this a little bit, but she's asking, what are your biggest tips for self-advocacy in medicine? How can we best help ourselves?
I would say some of the best things you can do to advocate for yourself are, when you're going into your appointments, if you have very specific things you would like addressed, I really think write them down, because even me as a nurse, when I go in to see my primary care provider, I suddenly can't remember why I'm there. I'm like, oh, I'm fine. I don't know. I'm good. And I just can't remember why I'm there. My mind goes blank. Lots of people have white coat syndrome where, they get super stressed. Their body's like, oh, our bodies can't tell that we're not being chased by a tiger. We're actually in the doctor's office, even though sometimes the tiger might be preferable. But write down your concerns so that you can keep yourself on topic and you can bring your provider back on topic in case they tootle off, because sometimes they do that. And then, I stay calm when you're in the office. It can be really easy to get really mad. And but just, you know, once people start getting really worked up, you know, healthcare staff basically stops listening because they're just like, oh God, which is not necessarily the appropriate response. But the calmer that you can stay and the more collected, you know, the more people will listen to you. And I have been in that position where I have just wanted to lose my mind at, you know, a provider or someone because they were just really not listening to me and my concerns. And it was incredibly infuriating. But again, you know, also when we get angry and when we allow ourselves to, you know, just kind of flip that switch at the front of our brain, which is where all of our rational thought and ability to think just shuts off and our animal brain takes over. And your lizard brain is not the place to advocate for yourself from.
Yeah, it's not going to be doing a lot of good.
It's incredibly hard, but I do a lot of deep breathing, or at least I did when I went to my old doctor's office. I did a lot of deep breathing before, during, and after.
So Annalee, tell us. Oh.
Go ahead, Nikki.
I was going to change subjects. I wanted to hear more about Boundless and Curious, but if you had another question about that, we'll wait.
Well, because I was going to go back to what you were saying is take notes about what you want to talk about. But at the same time, my mom just had a doctor's appointment specifically for her hearing. And she just got hearing aids, which she's avoided for years upon years. So we're so grateful. But of course, she's still not very interested in them. So anytime there's anything wrong with them, she's like, see, this is not for me. So we've gone back to the doctor, and when we went, she had a whole list of things she wanted to talk about. And the doctor was very excited that she had lists. She's like, I love lists. Then we can touch on everything. So there's still an issue with her things, but she said, go home and document every time they do this thing that they're not supposed to do. Yeah. That way, when you come back, I have reason to change it up for you. Yep. So I was going to say when people at home and they don't know what's going on with them, if they are writing down at this time, I felt like this, and this is what I did before, this is what I did after, and then they can take that in. Is that more of a way to advocate for yourself? Because you have specific things to talk about. Because I know when I go in the doctor, I don't remember all the stuff that that happened before I got there.
Yep. So if you are having weird stuff, document it. Document the date. If you're able to, document the time, and then, you know, write down a brief description. Even it doesn't have to be a novel, but that can be super helpful in pinning down, you know, maybe what's going on.
Tanya recommended an app called Bearable that allows for symptom tracking.
Oh, cool.
And other factors from weather to activity level, etc.
That's cool.
That could be helpful to people who are dealing with that kind of stuff.
And then also I would say sometimes things can be helpful if you're having physical symptoms that are not reproducible in the doctor's office, like with erythromyalgia, your feet can turn red and burn for no apparent reason, for example. And that's not a reproducible thing. You can't just look at your foot when you're in the doctor's office and be like, all right, have at it. It doesn't work that way. So what some people do is they'll take pictures, they'll take video. You know, there was someone who was having, you know, some weird heart rate stuff, and their doctor's just like, you're fine. You've had a Zeo patch. You're fine, whatever. But they were just like, no, this is not okay. Fortunately, they were able to actually, you know, see their pulse in their throat when it was being weird. So they took lots of video of it, and then they brought that to their cardiologist, who was like, oh, this is really bizarre. You know, let's do something about that. But because it wasn't reproducible in the office, you know, when they first went back to the office, the cardiologist was like, you're back. Great. And they were like, well, I have these recordings. And then he's like, what, of your Apple Watch? And they're like, no, I have video. Don't be a dick. But it was super helpful. So if you have pictures, if you have, you know, video, if it's, you know, something worth watching on a video, that can also be super helpful, because then your provider can see what's happening when it's happening, as opposed to you just trying to describe, well, my foot gets red and burns, because it's just like, okay, sure.
What'd you step in?
Right. Like, you know, did you step in some fire ants? Like, what happened here? But when you can show them a picture of, you know, this foot looks totally normal. This foot looks like, you know, you just boiled it for 10 minutes. Like, then they can be like, oh, yes, that is strange. So
Britt also recommends the journal app Simple, Symple, as another option for tracking things.
Yeah. I'm kind of an old school paper and pen tracking person. I keep trying to use
okay.
tracking apps, and
she says that's okay.
I struggle. But yeah, lots of people, and more people are developing apps for this kind of stuff because of these reasons, and it's good.
Go, Nikki, go.
Oh, no, that's okay. I feel like we've jumped into this huge medical world and all this stuff, and we need to have a whole other conversation about the rest of it and your business and everything.
The dog of eternal stench.
Isn't it? It's like you're always getting sucked into this. So sorry. Yeah. But I do want to learn a little bit more about Boundless and Curious.
Yeah.
Your fancy website that you've got up now. So tell us a little bit about your services that you provide.
Yeah. So with Boundless and Curious, Britt, my wife, we actually run it together, and we're both nurses, we're both coaches, and then we also do some other, creative stuff as well. But we offer coaching with, from a nursing perspective, and that is a benefit to just, any kind of coaching can be really super helpful. But I think the benefit to having coaching with, the nursing background behind it is nurses are, trained to look at, the other things that might be affecting what is presenting at that moment. Like we look at, the psychosocial things. We look at, things like, where's your stress coming from? Is there poverty involved? Do you have enough food? It's easy to tell someone you need to eat healthy, but when they can't afford food 3 days a week, that's not helpful. So, just having that kind of holistic nursing perspective informing our coaching. Also just that so much of nursing is coaching when you're doing good nursing. They're kind of seamless. They just fit together so perfectly. So we do offer coaching. And then we also have consulting. There's two different kinds. We have healthcare consulting, which basically if you are having, either a new diagnosis of you or a loved one of, some sort of chronic illness or, some sort of big medical thing where you're just like, oh my God, this is just so much. We can help you get organized with that. We can help you, learn how to ask questions so that you are asking effective questions of your providers, how to, kind of use your primary care as your hub, and then your specialists as all like the spokes of your healthcare wheel, to keep everything rolling and turning. And also just explain healthcare stuff because, I take for granted that maybe some of y'all did not know what viral load was. So thank you, Britt, for calling that out. But we can, it can be really embarrassing to be in your doctor's office and they're like, blah, 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 epiglottis, blah, blah, blah. And you're just like, I don't know what these words mean, but you're too nervous to ask, or you feel like your provider doesn't have the time to answer your questions. That is one of the consulting things that we can do. We can answer your questions. We can help define things and basically break down. Like if someone tells you you've got COPD, we can be like, here's what that means. Here's what your body is or is not doing through this disease process. And that way, because once people are really able to understand what is going on with their body, they're usually able to kind of figure out what they can do to, improve their life quality once they understand what's actually happening. So being able to break those kind of complex things down into understandable human terms instead of medicalese, is something that both Britt and I specialize in. It's something we both really enjoy. And then we also do some creative consulting. If anyone is writing a novel or a screenplay or anything like that, and they're including any kind of healthcare or medical stuff, we would really, really love to help you get some of those details right. because
you have no idea how valuable that is. My husband is a nurse, like I mentioned to you earlier, and he made me rewrite an entire scene of a dude who got shot and then left the hospital the same day. And he's like, no, it can't go in there. It needs to go somewhere else for this to work right.
Him.
Yeah, so if anybody ever reads Unbelievable, the medical piece of that is there.
And like there's a little bit of fudging that you can do. You don't have to be like 100%
I'm like, he's gonna go get his girl. What do you mean he can't get up?
I think there's like roughly 16 million Americans alone that work in healthcare, and we read y'all's books and we love them. But every time there's an ink pen tracheotomy, I'm just like, oh dear Lord. Or when people are like, we're doing CPR.
Wait, what about a tracheotomy?
Oh, there's
like they're in the airport, like
there's always an ink pen tracheotomy.
With like a big pen.
Like, yes, and I'm just like, But anyway,
movies are pretty.
Blame it on TV.
I don't understand how you and Britt possibly watch a movie together, being in the healthcare field, because my husband alone drives me insane.
That is exactly what happens. We spend most of the movie, like throwing shade at it because we're just like,
So very valuable service they're offering there, folks.
but it could be a lot of fun, I think, for that too. But then also Britt does beta reading, and she does some sensitivity reading for authors out there. And there's a list of the different, services she offers very specifically on our site. And yes, so I think Britt, tell me if I forgot anything, but I think that is.
She's silent.
Okay, good. And that means I didn't forget anything. But yeah, so that is what we're doing. We're kind of marrying, our love for nursing with our passion to go outside of our healthcare system.
It took her too long to type it.
I was getting scared. I thought she walked away on you.
No, she's still at her computer. She's listening. But no, like I think Boundless and Curious, that pretty much describes Britt and I. We love learning new things. We love, deep diving into things. We are eternally curious people about all kinds of things. And we both love, nursing and medical stuff, but we also, it's very obvious to both of us, and it bothers us a lot, that our current medical model here in the US is so limited. And also, even though they're moving more towards holistic wellness, they're not there yet, not even close. And so we want to help people, help themselves basically to have the best life quality possible, because, there are a lot of things we definitely need our providers for, but I think there's a lot of things that we can also take responsibility for ourselves and take on ourselves to help us live well and, live full lives that are meaningful to us, that our providers couldn't help us with even if they tried, because all of that stuff is going to come from within each of us individually, and it will be different for each of us. And, and that's a good thing, because if it was the same, it would be boring. But so Boundless and Curious, I think, is our marriage of, some of the creative stuff we love to do, as well as, the nursey stuff we love without having to try and do the nursey stuff, we hate, because there's a lot of nursing that is wonderful and very fulfilling and very satisfying. And then there's some of it where you're just like, oh God. And so, being able to use our nursing in ways that's meaningful to us and meaningful and useful to other people is really exciting for us to be able to do.
Awesome.
Thank you so much.
Yes.
Go ahead.
Wait, Britt took a long time to write all of that. Does anybody want to read it?
I'll read it.
Hold on. Yeah,
so she started. There's a read more button. Okay. So nursing is where medicine meets the human experience. Using that experience and perspective, that whole human perspective, we make a safe space for people to make progress towards goals. We are so much more than our bodies and our history and our trauma, but those things inform our lives too. You don't have to explain or defend your existence to us, and we want you to be successful. And then she says in part 2, she wants to hear about how everyone finds balance around being an indie author and creative. We actually had a video on that not too long ago, I think.
Nice.
Well, sort of.
But it's something we have to discuss now and then.
Yeah.
Sure.
This was awesome.
I know. I feel like we blew through that hour.
Oh my god.
I know. I feel like we didn't even
So
touch
fast.
like the tip of the iceberg there. Like, and we might have to do this again, Annalee. I hope you're okay with that.
I'm totally okay with it. I've had such a riot with you guys. This has been lots of fun.
It was a lot of really good information, though. So definitely things that we all needed to hear.
Are we able to have 5 people on at once?
Mm-hmm. We can have up to 10.
Have
you both, if you and Britt
both on at the you should get Britt on here.
Yeah.
Yeah. I mean, I got you gave me your card at the conference, and so that's what I had. And I was like, we should have her on. Because I didn't know this.
I couldn't even remember who I handed out my cards to, and so I was just like, how did they find me? That Britt's like, you handed out business cards. I'm like, did I?
I just have a pile of them, and I just every once in a while I'll look through and this one stood out.
So just in case for those of you watching, if you did not connect the dots, we met at 20 Books Vegas, which we had talked about when we got back. It seems like that's what we're going to do is every year we'll go and we'll collect our speakers for the next 12 months, and then we'll go back again.
Winter gets them
because that's where all the cool people are. I know. To be fair, y'all, I didn't talk to anybody. Oh, I guess I can take credit for Kristen.
Yeah,
I'll take credit for Kristen
first, right?
Yeah. Me and her did the erotica panels together. That was how I got to know her. I was like, okay, you're like us. We could chill. But that's it. Winter finds all the people, of which we are eternally grateful.
Sorry, there's more stuff we have to read before we go.
Oh my gosh. Every time I turn away from my phone.
Britt says, things we hate, never peeing so much, charting, we can't spend time with our patients, 12-hour shifts that are actually
as
14,
nurses.
missing our family. Yeah, I didn't read it ahead of time, and so that's why I stumbled. I was like, wait, what? So much charting, what does that think? Yes. And then Britt says, the info dump is real, run everyone. Tanya says, thank you. Sonia says, it's been fascinating, fabulous, Annalee.
Yeah, this was awesome.
And she says, what? I don't
Britt
know. Says, no, I can control it when I don't have
a keyboard. Going to the bathroom. Like all the things she was saying as nursing, like when she at the hospital.
She can control it when she doesn't have a keyboard.
Oh.
But right now she's got a keyboard, so she's dumping.
Info dumping.
Oh, info dumping.
Yeah.
Sorry.
Took a minute.
Oh, that's okay.
And all of us, I figured that out.
Yes, the info dumping.
We're all being authors right now and getting all sorts of different ideas. Oh man, thank you.
Yes.
Yeah, thank you guys
really
so
glad
much.
You came.
This was so fun.
And made time
I was
for us.
nervous, but I'm super glad that
you didn't show it at all.
Put my big girl panties on and showed up.
Yeah, you know, great. Some of us might not even have pants on. Some might be in pajamas. You never really know what you're going to get here. There's no reason to be nervous.
Mm-hmm.
Pajamas. I put on a real sweatshirt instead of my pajama flannelly top.
Right.
To be fair, I may sleep in the joggers I've had on all day today, so we'll call those pajamas. But yeah, we're not fancy, Annalee. This is it. Nothing to be nervous about here. In fact, our guests usually look better than we do. That's okay.
Almost always.
I think y'all guys look lovely.
Okay.
Thank you.
I washed my hair today.
I did not.
Put on lip gloss.
I did not wash my hair.
I did not.
I hadn't
put on
done
lip
it
gloss
in several
and
days.
drank it off in my tea. So I have I don't know.
Actually, I went and got earrings for you guys before we started. That was it. That was my effort.
I can't.
And you can't even see them because my hair is a fluffy mess. Anyway, it's 9:06. I am sorry we are keeping you. But again, thanks so much. It was amazing.
Yeah,
we had a great time.
So much.
Yes, thank you.
Really
and thanks, Britt, for being our guest in the chat.
Yes.
Yeah.
And everybody asking questions and commenting. That was
she was really helpful. Thanks, everybody.
Great to have all the participation.
Right,
Tanya says, go for it, Nikki.
What am I going for this time?
I think sleeping in
I think
your
you're
joggers.
trying to go to bed.
Sleep,
yeah,
probably sleeping.
Tanya, I'm just gonna sleep in this whole thing. Really, I'm gonna lose the bra, lay down in the bed right now, and it's over. It's 9:07. Let's be real. Yes, I am. Yes, I am. You know why? It's because there's a tank top on too underneath us, and it's multiple layers to get her off, so she's still on. Anyway. This is when we should push end stream. Who do we have next? What's coming up next?
Okay, sorry, I don't have the calendar. One sec. Next, we have on the 15th, February 15th at 1, we have Lee Fur coming to talk about Women of Wealth. It's a financial planning kind of thing.
That's right. Yay. That's also the day my next book releases.
That's one of my friends.
Yeah. Yes, Winter meets people too, all the time. Lots of people.
He meets no one.
We're going to work on that.
I don't think so, no.
I accidentally meet people.
Event, though, won't you?
I accidentally meet people.
They just drag people up to me all the time throughout the entire conference, and they're like, this is so-and-so. In fact, Annalee, I may have met you there and just not even. Too many faces and names.
Yeah. Yeah.
They were running around like crazy people, and I was like, I'm going to go take a nap.
Yeah.
I'll see you later.
Yeah.
Hey, Nikki, before we stop, would you mind actually announcing the event that we have coming up, the actual live event that we're doing?
That would be great if I had all that information in front of me. Thanks for the prep, winner. I don't even have the date.
Roll through our text. Hold on. I have my calendar.
Okay. Crazy Writer Chicks
it's in
first
April.
Creative Retreat. I know it's in April sometime. Becca does the date stuff.
It's from the 22nd. It's Friday the 22nd through Sunday the 24th.
Correct. So the 22nd to the 24th.
Easter.
We are going to be in St. Augustine, the hotel. All the details are in the group under the events page. It is a Hilton, I think. I can't remember. Why did you do this, Winter?
No,
I did not write.
We'll talk about it next week. I'll have all the info.
Everyone to come and hang out with us for basically 3 days. It could be cool. If you want to come, St. Augustine, the dates they said, you're welcome.
Absolutely. If you missed the invitation, go under your invites and you will find it. Otherwise, the event is listed on our events page. It will be an in-person retreat. So just so we're clear, we're all going to see people.
And talk to them.
If you want to.
Yeah, it's going to be great.
I mean, people, if someone's idea of a retreat is sitting by the beach and not talking to anybody except for, once in a while, then they can do that.
Yeah,
you can sit and write all day if you want to, or come and make jewelry, whatever your craft is.
Sure. Right. But it's a fun little town if you have not been before. A lot of cool stuff to see. Very inspirational. And there's an ocean in the back of the hotel. So that's where you'll find me.
Oceans are nice.
All right.
All right, guys. We're going to go now before someone asks me another question I don't know the answer to. Thank you, Annalee. It was great.
Thank you guys so much. Have a good night.
Bye.
Good night, everybody.
Thanks again.